If there's a one-word definition of refined sugar, it's poison. Refined sugar is not a food. Hi, I'm Dr. Mona Morstein, and welcome to my channel. I've been a naturopathic physician with 36 years experience. Today, we're going to talk about stopping sugar for 30 days. Now, if you haven't already, please join my channel by clicking on the subscribe button. The definition of food is any nutritious substance that people or animals eat or drink or that plants absorb in order to maintain life and growth. Sugar is not nutritious. Animals in general do not eat it, except some bear, sometimes with a little. It does not maintain life and growth. It harms life. And the main growth it causes is around here, not, up here. So what do I mean by refined sugar? I mean white sugar, brown sugar, cane sugar, honey, agave, sucrose, glucose, dextrose, fructose, maltose, corn syrup solids, high fructose corn syrup solids, cane juice, organic evaporated cane sugar or juice, rice syrup, barley malt, raw sugar, maple syrup. I think that's at least a pretty good list right there, right? Those are all refined sugar. Coconut sugar. I left off coconut sugar or coconut nectar. Also refined sugar. Now, I don't mean fruit or a little bit of fruit juice or a bit of unsweetened dried fruit or date sugar or molasses. Actually, the last two have pretty good nutrients in them. But the main problems with regular refined sugar are it tastes very good, it's addictive, and it has no nutrients in it. Just calories. Let me tell you a little bit about my personal history with sugar. When I was 10 years old, I developed obsessive compulsive disease. And that was a really bad thing. I had this problem that came on at nighttime with me getting compelled to do cleaning around my bedroom, the bathroom, straightening everything, pushing the drawers closed, pushing the closet closed, going to the bathroom, the faucets are off, the towels are perfect, and then going to bed and then getting a compulsion to wake up and check everything again. So I had also developed at this time these weird little seizures where I would be active and playing, but I'd have no memory of it. I remember the very first time it happened, I was at summer camp and I hit the ball to play a game of tetherball with my friend, and the next thing I knew, it was over and I had no memory of what had happened or if I had won or not. And these things continued for about 6 years. My mother was really into nutrition and she gave me more and more supplements and tried to get me to stop eating sugar. Gave me the book by William Duffy, Sugar Blues, which came out around 1974, about the perils of refined sugar. I had an EEG to see if I had seizures and a blood sugar test to see if I had reactive hypoglycemia, which was borderline. Then eventually I had really a nervous breakdown from having to get up at night so commonly. All of this happened, and finally, one day, after 6 years, I decided to stop eating refined sugar. And that's what I did. 1 month later, I had no more seizures, which I've never had in my life again. And within 2 months, all of my obsessive compulsive syndrome disappeared, which has never also returned. In fact, I'm a little on the messy side right now. So sugar is a poison. It was a poison in my brain. I think it's a poison for so many people. I mean, what does it do to the human body and mind? Well, it is empty calories, and it does there lead to weight gain. It's very pro-inflammatory. There's science showing that sugar increases interleukin-6 and tumor necrosis factor alpha, which are very, very, very pro-inflammatory chemicals, right? And that can have effect all over the human body. So sugar also increases pro-inflammatory, what we call cytokines, pro-inflammatory chemicals, particularly interleukin-6 and tumor necrosis factor alpha. Now, tumor necrosis factor alpha can cause inflammatory bowel disease. There's actually a drug used to treat that, to block that in the gut. It can go systemically. It can cause insulin resistance in your muscle cells when it gets into your body. These are causing a lot of inflammation, as well as just pain and anything going on in the body. So sugar increases those. Sugar is also associated with a higher risk of blood pressure, diabetes, we talked fatty liver, and osteoarthritis. In fact, when I treat patients with osteoarthritis, I don't think I've ever seen a patient who had osteoarthritis who didn't have a sweet tooth. And when we pull sugar out for 1 month, I would say 95% of patients come back 90% better with all the aches and pains that osteoarthritis can cause. It's really associated with that. In the book by Melvin Werbach called Nutritional Influences on Illness, he reports studies showing that sugar lowers your immune system, that a teaspoon of sugar can reduce your immune system for up to 5 hours. And there's 10 to 12 teaspoons in a can of regular soda pop. So if you have a little sugar in your coffee at breakfast, and then maybe just a cookie in the break room at lunch, and then just a little bit of chocolate after dinner, you could have a decreased immune system for most of the day. That's not good to stay healthy and strong and protect yourself against even things like cancer. We really want a strong immune system. Now, sugar also increases dopamine in your brain, which is the feel-good neurotransmitter. And that's one of the main reasons that it can be so addictive. We crave sweet because maybe we don't feel so good the next day physically, but right then, it's so good, and we make a chemical that enhances that. Obviously, sugar is renowned for causing tooth decay, and it also causes initially what we call reactive hypoglycemia. So when we're young and we're eating sugar, we can have it get out of our bloodstream pretty quickly. And then we get irritable, cranky, just out of sorts, right? Especially when we're hungry. But over time, as we get older and we're exercising less and eating the same sugar, and we get that gut that happens, then the sugar causes the insulin resistance, which is when our blood sugars go up and we become pre-diabetic or even diabetic. So these are really concerns in that regard. Now, sugar is also associated with cognitive decline, like dementia and Alzheimer's. Who wants those, right? Sugar also can inhibit collagen repair. So you're going to get more wrinkles, you might have some hair loss, you might have poor wound healing, because those all require a lot of collagen. It's also associated in the brain. Anxiety, depression, OCD, ADD, and ADHD all have relationships with eating refined sugar. And another thing is that when we make some bread, we have flour, water, yeast, and then sugar to feed the yeast. So if we're eating a lot of sugar, then we can feed the yeast that naturally occurs in our body, such as for women, vaginas, right? Getting a lot of yeast infections. But yeast is a natural fungi, our natural part of our gut. And it's really great and easy to overgrow fungus in the gut and get bloating and distension and brain fog and achiness and interstitial cystitis and all kind of things that too much fungus in the gut can cause. As well as, of course, we can grow it on our body. Intertrigo or athlete's foot. We can be feeding just fungal overgrowth on our skin with a high sugar diet as well. In fact, when I stopped eating sugar and my health turned around so drastically, that was one of the primary reasons I was led to get a degree in food and nutrition and then become a naturopathic physician. I did still eat honey now and then, but when I was in medical school, I gave up all refined sugar Monday through Saturday, and only allowed myself to eat something sweet on Sunday. And this caused tremendous withdrawals in my body for around 3 months. It was intense. I was really addicted. But that made that, tidying up my sugar intake to that last degree, which I did 36 years ago, I think has been the number one benefit, healthy thing I've done for myself. And I have never broken that. I will not eat anything with refined sugar in it Monday through Saturday, and only on Sunday. Now, Sunday I get up and eat 3 eggs and eat a little bit of sugar and go hike 9 miles and come back and have a little more sugar at lunch, and then I'm done for the day. I don't eat too much. My body doesn't want it, and I can control that now. One time, bought a caramel apple and I ate the whole thing, and guess what happened? When I put too much sugar in my body, I felt this wave of anxiety go through my whole body, hair to toes. And that lasted for like 2 or so days. So I know the anxiety and the obsessive compulsion is still probably in there, locked away. And the key to open that up for me is refined sugar. And I bet it's for many other people. Refined sugar is causing also physical and mental, emotional problems. Nowadays, when I do this with patients, there's some ways that we can help the sugar not be so intense a withdrawal. We can give chromium and zinc and vanadium to help level out the sugar, and also gymnema sylvester, which reduces cravings and really helps the blood sugar stay level, helps the pancreas. It also, in a tincture, can stop the sugar taste on the tongue. Can you eat natural sugars, say, during the week, or alternative sugars, I should say? Yeah, I don't have any problem with stevia, monk fruit, allulose, xylitol, inulin, and combination products. Now, erythritol has been on that list, but it can sometimes cause intense gut symptoms because it's not well absorbed. I mean, I can eat a little of it, but I can't drink anything with erythritol in it without, agony. And there are some recent studies showing it may lead to heart disease. I mean, maybe, but where are all the newspapers blaring out sugar is proven, to do that for sure. I also don't like people to use sucralose or aspartame. These have really negative impacts on the body, really harming the gut microbiome, headaches, depression. Just really don't want people to use those. Now, if you can do a challenge and pull out all sugar for a month, or even just eat it 1 day a week, but the same day, not changing the day, like it's only Sunday, like with me, or just Friday night if you go out with your husband to a nice restaurant or something along those lines. You choose 1 day that stays the same. That can be good enough for people to have an amazing difference. Now, it's really good to just pull it out for a month if you can, totally. And then maybe if you add it in 1 day a week. Now, people with diabetes can't just eat sugar at all, right? Or people that have potentially other really ill, very inflamed bodies where sugar is just feeding a fire that we don't want to feed. And they should just stick to the healthy alternatives. Now, you're going to notice that of really cutting back on sugar, your taste buds will change. You will not want to eat the sugar in any amount with any frequency that you've done in the past, because taste is a chemical on your tongue, and that changes with what you put on your tongue. And all of my patients come back and say, I avoided sugar. I felt so much better. I'm alert. I don't have headaches. I'm not achy. My mood is good. I'm feeling much more energy. I don't have my arthritis, etc. And then they go to a wedding and have a piece of wedding cake, and they're like, I couldn't even eat the whole cake. It just was so cloying. And that's a well-balanced body. right? We wouldn't say, if someone just wants to run out into traffic, we wouldn't say their brain is very well balanced. And bodies that want to eat a lot of sugar are not well balanced. And when they get balanced, they don't want it. And you'll notice this too. So take a month and no sugar, that's the best. But if you have to, 1 day a week, and then you're committing 6 days, no sugar, that'll work too. That's a challenge. Give it a go. I am so happy I don't eat refined sugar, and I think you will be as well. Thank you for watching this video. I hope you enjoyed 30 days without sugar. If you liked it, please push the like button or the subscribe button. If you would like to have a new patient visit with me or get a complimentary visit, please go to my website, Dr. Mona Morstein, and fill out the contact form.